Good evening, one and all. Following the series of wonderful sessions we've had from today's morning, we now have our final session for Media Meet Day 1. The pandemic has caused much distress and chaos in two main sectors, that of health and that of media. To help us understand how these sectors are working in this pandemic, we have put together this panel titled Communicating Health, Media Coverage of Health During the Pandemic. Our panelists are Ms. Madhur Singh, Ms. K.K. Shailaja, Mr. Prabhat Sinha, and Dr. Asha Pinto. Moderating this session for us is Dr. Nirmala M.N., Assistant Professor at Department of Media Studies, Christ Deemed to be University. Over to Dr. Alex.
Thank you, Aparna, for the wonderful introduction. Now, I consider it as my honor and privilege to introduce Srimati K.K. Shailaja, teacher, the former Minister for Health, Social Justice, Women and Child Development, Government of Kerala. On behalf of the Department of Media Studies and Christ University, I extend a very hearty welcome to you, ma'am. Thank you.
And it's my proud privilege to introduce our other panel members. We have Madhur Singh, currently Managing Editor at India's Pen, India's foremost public interest data journalism website, where she has overseen coverage of COVID-19 crisis. Thank you, ma'am, for joining us. We are also joined by Dr. Asha Pinto. She is a medical officer, chief medical officer at Christ Deemed to be University. She's a medical doctor with fellowship in family medicine and background in counseling. She graduated from St. John Medical College, and she has been with Christ University for more than a decade and has played an active role in setting up COVID-19 protocol for the university. Thank you, ma'am, for accepting our invitation and to be part of the panel. And finally, we are also joined by Mr. Prabhat Sinha, founder and CEO of Man Desi Foundation. Currently, Prabhat runs Man Desi Champions, which aims to empower young girls with sports power. Wow. Sports, health, agriculture, what a diverse background. Thank you, Mr. Prabhat, for joining in. Thank you all panelists for joining us today for this very important discussion. So not taking much time, I would like to get started. So my first question is to Shailaja teacher. Right from battling Nipah outbreak, flood, and ongoing COVID pandemic, how was the state health department mentally dealing with this series of fights, one after the other, and also handling media criticism of the Kerala COVID management model, which was internationally and nationally lauded? All the appreciations were there, and there were also criticism. But how was the state health department mentally dealing with this? Over to you.
It was too difficult, but anyway, we dealt with it. I think Nipah outbreak, it occurred in Kerala, and the source is in Kerala. At that time, we are not aware of such kind of viruses, and it was a very hardship during that time. When I came to know that one of the family in one of our village is suffering with a particular disease or peculiar disease and severe symptoms, and they are singing, then I asked my doctors and my health secretary to inquire about that, and we sent the sample to a virology lab, and it tested positive for Nipah virus. At that time, it is not familiar here. As you know, Nipah virus occurred only 4 or 5 places in the world. 4 or 2 countries, 4 or 3, I don't know, 5 countries, I think so. And it occurred in Kerala. At that time, it was a hardship and it was a irritating or disturbing news for us. But at once we decided we cannot hesitate and we should have to act to contain that contagious virus, and we started our working. When I heard about the case is positive for Nipah, at once I rushed to Kozhikode, and we opened control room at once, RRT formed, and everything was arranged within 1 or 2 hours. And we started our working. And we have no protocol or standard operating procedure for the containment of Nipah virus. And you know that there is no medicine, proper medicine for this kind of virus. And also there is no vaccination, and it is a severe thing. But we didn't hesitate for a moment, and we started our work. At once we started training, and also we formed the isolation unit in our medical college and proper meeting there. And we go to that village also. We make aware in people to the whole population there. And I'm not elaborating this thing, but sudden action and proper action, scientific thought, and belief in science, everything helped us to tackle the problem, and we can reduce the mortality rate of COVID-19 pandemic to 0.5%. After this this assembly election and after the Onam celebration, etc., there is a rise in the case, but I think I am enthusiastic that we can contain or we can control the virus as in the previous case. Previously, during the first wave, we delayed the peak, and also we contained the virus and we flattened the peak within days. And this time the peak is going on. It is continuously, but I think if you act properly, we can another time also we can flatten the curve. And now also the mortality rate as a whole, average, it is 0.5%. And the lesson we learned from this virus infection is that if we work hard, work collectively, and work with enthusiasm, we can contain this kind of virus infection, and any hardship we can overthrow or we can work over enthusiastically.
Thank you, ma'am. Thank you so much. I think it just set the right code for our discussion for the day. Taking from where Shailaja ma'am started, my question is to Madhur ma'am. Shailaja ma'am, politicians like Shailaja teacher are exception. But we all know not all politicians and political parties have kept the channel of communication to media open and accessible. This being the case, how did platforms like India Spend deal with challenges such as lack of communication by the government and access to data, especially during the ongoing crisis that we are all in? So can you please elaborate on that, ma'am?
Yes, thank you for your question. It's very interesting. And I must also thank Shailaja teacher for taking us all back to the early days of the pandemic. Fair bit of confusion for everybody, no clear information coming from any quarters. I think readers, journalists, policymakers, leaders like yourself, everybody was sort of in the same boat in terms of what information we had initially. You know, COVID-19 India.org is going to shut down in a few months' time, and there's going to be a whole set of data collation that's going to completely go out of the public domain. We will not have data of various kinds. You know, it's one thing to know just the case numbers and the death numbers, but to be able to make connections and join the dots to understand the context and background of what's going on, that's going to be a complete challenge all over again for all of us. So various crowdfunding efforts of this kind have been irreplaceably invaluable for journalists like myself, for our newsroom. The cause of mortality is not correctly recorded in our statistics, and we believe this is a really pivotal moment for all of us to learn from that and to make fix the loopholes that have been in our system, because this will provide us the data that we need on mortality from various causes, from various diseases, help policymakers expend efforts and resources on the diseases that are actually causing most mortality once we understand it a lot better, and then make things easier for all of us as individuals, as citizens, and as curious, informed voters. So this is, I think, does that answer your question?
It did. But definitely, I'm sure India Spend is a very important platform, very important source for we journalism teachers, especially for our data journalism class. And I'm sure our students who are listening to this conversation understand the significance of data journalism, especially in a crisis like this. Thank you. Thank you so much. Thank you. So my next question, just to set the tone for the conversation, is to Mr. Prabhat Sinha. We have heard from the government, we have heard from media. We'd also like to know NGO, an organization like yours, Man Desi Foundation, which has been working in the area of health and women empowerment. What is the kind of challenges the organization is facing during the crisis, like NGO sector as such, especially those working in the area of health and women empowerment?
Yes, so thank you for having me. Really appreciate it. To be honest, if you would have asked me this question 2 years ago, I would have never been able to be on this platform and tell you about, like, I'm working in healthcare, or I'm working with the people who are suffering from COVID or things like that, because I've been an athlete my whole life. Then I've been a coach. Then I became a sports agent in the US. So I had no idea that person like me would come, or we will be in the villages of India, and I will be able to start a hospital. Like a sports athlete would able to run a hospital. I never even had a dream like that in my life, because I never thought about those things. And actually pandemic really opened up to our healthcare, especially I live in state of Maharashtra. My hometown is about 6 hours from Mumbai city. So the first time in my life, I realized that 70 square kilometers from my hometown, we don't have a CT scan, we don't have MRI. It just opened my eyes by looking at, like, okay, I knew probably this was there, but it never came into our attention till the COVID hit. Now everybody's going, I'm talking about the second wave, especially in March and April, everybody was looking after this HRCT scores, this CT scan, you have, out of 25, how much you have, and people are going crazy. Healthcare should be always a priority. Education is affecting a lot with COVID. And every single of us, we need to think about what we can contribute and how we can build structure. So going forward, actually, we are doing a partnership with Georgetown University and then some of the funders from the US. And we are thinking about opening a charitable hospital. Apart from that, we are doing this study with Georgetown on public-private partnership, where how public-private partnership hospital can be built, and not just in Maharashtra, but it can be built in Gujarat. It can be built in country like India, like Ghana, Nigeria. You can see the difference in my public-private hospital, a partnership hospital. We had people coming in from Solapur district, even different district, because they knew this hospital is really good. So if you really pay attention, if you really work hard, and if this can be curable, we can really do this very well. So yeah, I mean, this is just my experience of COVID, and love to hear from all of you.
Thank you. Thank you for also bringing the spotlight on rural sports, and especially girls in sports in rural India. Thank you. Thank you so much for bringing that spotlight there. Now, Asha ma'am, we would like to hear from you. As I mentioned at the beginning, Asha ma'am and her team has been a pillar of support to all of us in the crisis. Ma'am and her team are handling series of challenges. One of it is implementing government COVID guidelines and protocols to an educational institution, university of our scale, where we have 20,000 odd students. So we would like to hear from you the kind of challenges of, there are new guidelines almost every other day. There are revisions, there are expert views on whether students should come, not come, or what kind of protocols. So how you and your team are handling this challenge? Especially, it's also a model for other educational institutions. So we would like to know how your team is handling this challenge of implementing a guideline for an educational institution, especially for handling pandemic.
Thanks for having me. Yes, we did have our unique set of challenges when news of the pandemic started, but we started acting in as early as Feb 2000. But some of the challenges, if I could say, one was the massive flow of unprecedented and varied information. We had facts, we had myths, we had social media was just piling onto us, and along with that, there was uncertainty and fear of the unknown. Because the disease itself was in its nascent stages, so to speak. We were studying the disease, studying the effects and so on. And in that sort of respect, we did have a lot of our student population, having anxiety related symptoms and so on, which we I'll tell you in a bit how we dealt with that. The other challenge that we faced was to encourage and inculcate as COVID appropriate behavior, and to sustain that amongst the youth was particularly challenging, because they're very physical in that age group, and maintaining COVID appropriate behavior was quite a challenge. The other thing was dealing with skepticism and dealing with the infodemic. There were a lot of disbelievers. There were a lot of mask rubbishers and things like that. So that was another thing. That was another challenge. Quickly about our vaccination drives, we've done about 5 vaccination drives since about April. That's on an average 1 vaccination drive a month. We've vaccinated so far over 2,000 students and staff, but we've got a long way to go. And we're not going to stop until every single one is vaccinated. We also did a couple of outreach programs, as in packaged meals for the marginalized, the hospitalized, packaged refreshments for frontline workers at hospitals, providing financial aid to medical institutions. We did a blood donation drive during the lockdown. And we tried to time it such that, because once the student was vaccinated, he couldn't give blood for a month. So we had to sort of, time it appropriately and so on. Well, yeah, that's about the gist of, I had so much to say and I'm trying to condense it all, but that's about our COVID-19 response.
Thank you, Asha ma'am. It also tells us how prepared is the campus for the students to come in. Thank you so much. It's indeed, I'm definitely builds in confidence. So quickly, I have one question to Shailaja teacher, and then we have a list of questions coming in from our audience, and I'll start taking each those questions. But first to Shailaja teacher, one question. What learning from the series of disasters that have been handled, whether it is man-made or natural or virus or whatever, the policy interventions that you would like to suggest, because you have been talking about public health, how important to improve our public health, but what is the policy intervention that you would like to suggest to the state as well as to the central government? Because you have worked closely, and the state model has been appreciated, and so over to you, ma'am.
It's a very important question, I think so, because without changing the policy, all the countries throughout the world, we cannot the problems of this pandemic or natural calamities, etc. And the most important thing is the people-centered method. We should make awareness, and we should collect the capacity of all the people, and we called for a COVID brigade. Thousands of young people registered in that COVID brigade, and they worked as volunteers for the COVID work. Someone worked in the community kitchen, someone worked to visit the home, escorts, and the doctors and nurses who have the certificate of doctors and nurses, they worked in the COVID first line treatment center, COVID second line treatment center, and domiciliary care centers. They worked hard without getting any salary. They worked hard, and the participation of the people, that is the most important thing during the disasters and the calamities and the hardships. That is the important thing. Is we should have to invest in public system. Then only we can build up the public health or public school or public education system or anything. We should have to build up, and that will help us during the hardship days. And that is our policy in Kerala. And central government should adopt more people-centered policy in future. And the world itself should adopt this kind of policies.
Thank you, ma'am. There's one question from our audience to you, so I'll just read out that question, and I'm sure the comparison, comparison of how you handled COVID and how the current minister would be handling COVID. I'm sure that is bound to happen with the kind of popularity you had. So the question is, do you think the current situation in Kerala could have been prevented taking the right measures as you did during the first wave? So I'm sure you would have come across series of such questions. I'm sure media is also talking about it. And also another question that having so much of information from the first and the second wave, the third wave should be less scary. Over to you, ma'am.
Yes, the new minister is also working hard. When I came to office or when I become health minister, I was newcomer at that time. We should have to study the situation and we should have to act properly. That is the thing. And she is also studying, and I think she can also work as much as me. And during the first wave, we can contain the virus in proper time. And it is through the collective work of I have a very good team with me, and that team worked hard. I always saying that the real heroes are behind the curtain. That they are the healthcare workers. Without the help or without the hard work of the healthcare workers, we cannot achieve anything during a pandemic season or any health problems. And the new minister and the government is also working hard to tackle the problem current days. And the question about the third wave, I think there is no waves described in any health science or in literature of health about the waves. But we are saying it is a wave because all the pandemics shows a curve that sometimes it will peak and sometimes it will diminish. And we can say it is a peak. And in that sense, the first wave occurred during 2020, that is October, November, etc. And we can slow down the peak by scientific methods, and it flattened. And again, it peaked. And I hope they can slow down the curve or flatten the curve this time also. They are working hard. And the last question, what is the last question?
Thank you, ma'am. You answered all the questions. Thank you.
Okay, thank you.
Okay, over to Madhur, ma'am. Madhur, ma'am, you have a question. How pertinent is data? This is by Sohini Banerjee, and the question is, how pertinent is data becoming in a pandemic of state-sponsored misinformation and propaganda that is affecting people's life in all aspects?
Okay, great. I'm not sure I agree entirely with this state-sponsored nature of the allegation, but I will answer to how important data has been in reporting this pandemic. I would say it's been all important. What data has been available has been extremely important. What has not been available has also been very, very important. And why do we need data or information, correct information, especially in the pandemic situation? We need it for people to be able to make the right decisions, for you and me as citizens to be able to decide for ourselves. Shall I get a vaccine for myself? Shall I send my child to school? These questions can be answered much better when we have the correct data and correct information to base our decisions on.
Thank you. And my next question is for Mr. Prabhat. This is by, the question is from Janvi. Your work sounds very impressive. How did you and the people working with you deal with the setbacks?
Yeah, setbacks are very tough. So to be honest, when I had lost a couple of people whom I knew, like from nurses, doctors, and not doctor, but nurses and ambulance drivers and everything, and also people who I didn't know, like I was just saying, the people who are a part of people who are part of our program, or people who are just there as the patients. Right? I didn't know them individually, but things they shared with you, things just that you see the 30-year-old dying, you see 25-year-old. So that's really pain. And I had a tough time dealing with it. I didn't realize then, but after now, it's like last month I had to go and do a Ayurveda therapy for myself, to be honest, because when I was in Kerala to do this therapy and everything, because I think it was really, really tough for me to go through that, which I didn't realize then. But after 4 or 5 months, I realized that it's a lot of grief you are carrying with you. And when you see all those horrible stories, and then when you see it in your front of you, where you have two members in the family is passing away and all these things, so that was very tough. So that set back every one of us. But in our organization, everybody's there for you. So when something happens to, we have about 200 people in the organization. If something happens to 199 number person, I'll be there for them. So there for you, being there for each other is the only key which we always kept with ourselves.
Okay, thank you, Mr. Prabhat. Asha ma'am, there's one question. I'm sure this question is from, I'm sure you would have heard this question before. For college students above 18 years, is it really safe to reopen colleges with students coming in from various states and not vaccinated properly? Will it worsen the current situation, or is it smart to move to continue with online classes? I'm sure such queries you receive on a regular basis, more so now when we are planning for an offline mode. So,
well, this query is very pertinent given what we went through in the second wave. Fortunately, the university has left it open to you to make individual decisions. So we have what we call the hybrid system, where you have online classes and you are free to come into campus as you wish. So really, it's up to the individual, and you have that option. I know that, my son is in school and he may not have the option. He's in the 10th standard. He might have to go in anyway. And, something like that is worrying. But for Christ University, there's no such problem in the sense that you do have the option. Other than that, I would just like to say that I think one vaccine, if you're covered by one vaccine, although you are not very much protected, you're about 36-37% protected. If you do get COVID, the chances of hospitalization and mortality are very, very low if you've had even a single dose of vaccine, although the rate of infection can be quite high. Post-infection, the danger of going into a serious illness is very, very low. So, and also, if you follow the appropriate COVID behavior, in the sense that if you use your mask and keep social distancing, it should be absolutely fine. People like me are going to work. A lot of staff are coming into work. We're extremely careful. What I found with students is that they drop their guard. And, so even double vaccinated people like you, like me, are extremely careful. I still wear my N95 to work and so on. So a lot depends on social behavior more than vaccination.
Thank you, ma'am. With this, let's wind up our panel discussion. It's been a great evening. Thank you, each of the panel members, for taking your time out and sharing a very, very important insight to the topic that we have been discussing. Thank you, each of you. Thank you. Over to you, Aparna. Over to you.
I thank all the panelists, the moderator, Dr. Nirmala, and Dr. Alex, for equipping us with this niche knowledge about how different industries are affected by the pandemic. Thank you.